morning.
Hi, Miss May. It's Christina. I'm here to perform some catheter care for you. Would that be okay?
Yes, thank you.
All right. I'm just going to perform some hand hygiene, and then I'm going to go grab my equipment and supplies to begin, okay?
Okay.
I'm going to just go ahead and provide you with some privacy.
Thank you.
Hi, Miss May. I am back. I am ready to go ahead and perform your catheter care. I do have my supplies here. I have my basin of water, which I'll have you test to make sure it is warm, comfortable water for you. Good. Thank you so much. I also have my soap and 2 washcloths, one for washing, one for rinsing your catheter tube, and then one for pat and dry your catheter tube. And then I have my gloves. So before I begin, I do want to make sure that the height of the bed is at a comfortable level. So I'm going to go ahead and raise the bed at about waist level for me. All right, first I'm going to go ahead and apply my gloves. All right. My gloves are on. I'm going to go ahead and expose the area that I'll be working on with you, if that's okay. I will do that by rolling down the top covers about knee level for you. And I will go ahead and lift up the gown and expose the catheter. Okay. Catheter is in place. I have my gloves on, and I'm going to go ahead and place my 2 face cloths in the basin of warm water. Okay. So for this task, I'm going to be using my washcloth, first washcloth with soap, and I will be using the 4-corner method where I will apply soap to each corner. All right, Miss May, I have my soap. I'm going to begin with one corner of the washcloth. I'm going to hold your catheter in place where it exits the urethra so I can go ahead and clean the tube safely. With this, I'm going to go do 1 stroke down the tube, about 3 to 4 inches down the tube. And then I will change to a clean corner of the washcloth. And once again, hold the catheter at the where it exits the urethra, and then do another stroke down, and that will be 3 to 4 inches down the tube. Another clean corner. Hold the catheter 3 to 4 inches down, and then once again, hold the catheter, stroke 3 to 4 inches down. I have now washed the catheter. I am going to go ahead and rinse the catheter for you. How are you doing? Are you still comfortable? Good. All right, with the same method, I have my washcloth with no soap, and I will use a clean corner each stroke down the tube to rinse it. And again, I will hold it at the top where it exits the urethra. Okay. I've now rinsed your tube, Mrs. May. I'm going to go ahead and pat it dry. And pat any areas that might be wet. Feeling okay? Good. I'm going to go ahead and put this down. I am now going to remove my gloves. And I will cover you back up. How are you feeling? Good. All right, I am now going to just lower your bed back down to its lowest, safest position. And now I'm just going to give you your call light. If you need anything else, I will be here for the rest of the day. And I'm just going to put this within reach of you. And if you need anything, give me a call. I'm going to go and unprovide your privacy by opening the curtain back up. I'm going to perform hand hygiene and clean up my supplies. And I will see you later, Miss May. I'm going to come and do my hand hygiene. So I will be turning on the water to a comfortable temperature for myself, and I'm going to go ahead and make sure I get my hands thoroughly wet. At this point, I want to make sure that my hands are always facing downwards, and I will apply soap and begin scrubbing my hands, ensuring that all of my surfaces of my hands are covered with the soap. I'm going to make sure to interlace my fingers. I'm going to make sure to clean my fingernails by rubbing them against the opposite palm. And then I will make sure that I also do my wrists. And each fingernail, including the thumb. And then I will rinse my hands. And I'm going to make sure that I have done this for about 20 seconds before going under the water to rinse. I'm going to make sure all of the soap has been rinsed off of my hands. Again, leaving my hands facing downwards to let any excess water drip down. I will then go ahead and obtain my paper towels to dry my fingers, working my way up from cleanest to dirtiest in between my fingers. And then I will take another clean paper towel, turn off the water, and hand hygiene is complete.